Welcome back, everyone. There's new information out this week that could actually help men decide to get a prostate screening. Yay! Researchers at the University of Michigan have found that men who have routine prostate exams are less likely to die of prostate cancer. However, current guidelines from the United States Preventative Service Task Force recommend against PSA screenings. So what should we take away from this new research? Well, joining us now to discuss, we welcome our medical contributor, Dr. Ali Kasraeian. Welcome back.
Welcome, good to be back.
So what does all this mean? What's going on?
So you guys look lovely in blue except for you in green.
Thank you.
You didn't get the memo.
Too, in your Tiffany.
Yes, I had to work today. So here's a challenge with prostate cancer screening. For most cancers, you know, the idea of early detection translating into better outcomes and higher cure rates rings true, and it seems to be not that controversial. For prostate cancer, the challenges that have come up have been that could the screening with a PSA test, which is a blood test.
And it's been around for years.
Since the early 90s was when it became a little bit more commonplace in terms of being used. It's a blood test and a digital rectal exam. Those things together, the concern was, is screening leading to overdiagnosis and overtreatment, especially of cancers that may not ultimately cause people to pass away or die, and so the risks and the harms from the process, including the therapies, may outweigh the benefits. So it's a risk-benefits discussion. And the way I kind of think about prostate cancer in my own mind is there are 4 types of prostate cancers: rockets, rabbits, turtles, and snails. And I talk with my patients about this all the time. Rockets are metastatic prostate cancer. So when you come over, you diagnose the prostate cancer is out of the prostate. The whole reason we screen is to avoid that. So we're trying to catch things early while they're confined to the prostate. The challenge is not all prostate cancer that's within the prostate needs to be treated at diagnosis. So you can monitor them, active surveillance, things like that. So then you have the rabbits. Rabbits are prostate cancers confined to the prostate that are a little bit more aggressive. And so if we leave them alone, they could potentially get out of the prostate and become metastatic. So they need treatment. Kind of like if you think of prostate cancer as a cat. Is it a small kitten? Is it just a regular cat? Or is it a rabid, ferocious tiger, maybe a jaguar, depending on the week? And so that's what we're trying to figure out. The turtles and the snails, slow-growing, slow-moving prostate cancer that may not necessarily cause death, that's the dilemma with this. So if we screen, are we going to catch a lot of turtles and snails that may not need treatment? And historically, about 90% of prostate cancers were being treated. Now we do things like active surveillance, where if you have a low volume, low risk prostate cancer, turtle and snail, you can talk to your urologist about the concept of monitoring it, getting PSAs every 3 to 6 months, repeating the biopsy. And long-term studies have found that patients who are appropriately monitored with active surveillance with good criteria have more than a 99% prostate-specific survival, meaning that they don't die of prostate cancer, and more than 99% don't get metastatic disease.
Wow.
The dilemma is 30% of them, about 30 to 36%, the cancer may change on subsequent biopsies, needing therapy.
So why would anyone be against the PSA?
So the idea is that you do a lot of PSA, you check, and the PSA is, it's not like on the lab test, if any guy's seen a PSA, it says 0 to 4, but it's a little bit more variable than that. So you could have PSAs that may not be elevated because of prostate cancer, inflammation, and enlarged prostate. If you're getting a PSA test, guys, do not have any kind of ejaculation for the 2 to 3 days before, because it could falsely elevate it. So you have a number of different factors that could play in.
Asking a lot.
Yeah, so if we look at that, and we're biopsying a lot of guys, most of them...
We're trying to laugh on that one.
He's late to the party. Sorry.
The sound came around and then it hit me.
So what is the answer? Should you be getting the screenings, or should you not? Or maybe if it's just, you know,
yeah, so I
genetic?
think the answer should no longer be to screen or not to screen, but how to screen smarter.
Okay.
So,
and how are these screenings done?
So screening's a PSA test, it's a lab test, and a digital rectal exam. So what this study found, and they took 2 big studies, a European study and a US study, that prompted that US Preventative Services Task Force against screening in 2012. Grade D recommendation, don't see your doctor, don't screen. And they recently changed it actually to grade C, meaning see your doctor, have a conversation with your physician about screening. So if someone has an elevated PSA, now we have smarter ways of looking at that. You can get lab tests that look at prostate-specific results. A test like a 4K score, it gives you a percentage risk of having a rabbit, that more aggressive cancer that needs to be treated. We can do multi-parametric MRIs where we look within the prostate and we kind of open up the curtains and look within. If you find a tumor, now we have the technology technology to target it. I'm very proud of our clinic. We were one of the first in the nation, in the community, to be able to offer that.
Oh,
We
nice.
partnered with the NIH and a team in England with Mark Emberton and Claire Allen's group, and we really worked hard to bring this technology here. And we've done almost 400 of these since 2014. So it's a really good way of making sure that if you're going to get a biopsy and it's negative, you have confidence in the negative biopsy. If you do a biopsy and it's positive, you actually know what's going on. What kind of cancer? Is it a turtle or a snail? Is it a rabbit? Now we can look at the genetics of the prostate cancer and see how aggressive is the cancer. Is your cat like a kitten in its DNA-based behavior, or does it act more like biologically, does it act more like a ferocious tiger or a lion?
Well, speaking of a tiger or
swear.
a lion, something I'm very proud of you about. We're getting over now time for your run.
Yes.
The Zero Prostate Cancer Run Walk, 2nd annual, right?
Absolutely.
So
September 30th.
Tell us about it. People want to know.
So the idea with this is awareness. So we talked about screening, whether you should screen or not, and so early detection and knowledge are the most powerful thing for any kind of cancer. And with prostate cancer, that's really important. Us guys, we don't talk about anything. Guys with prostate cancer show up and their family doesn't know that they had cancer until they show up and talk to me. So talking about diseases, just like breast cancer, is important. So what we're hoping with this run is that it begins to raise awareness in our local community. We did a run last year; it was very successful.
Great turnout.
We appreciate everyone, and it starts the conversation in a fun way. And so for this to sign up, you can go on Facebook at zeroprostatecancer.com at Jacksonville. The website is zeroprostatecancerrun.org/Jacksonville. You can sign up. It's not expensive. You can get teams together. You can run for yourself. You can run for people you care about. Run for just the fun of running it. Intuition Ale House is joining in, and we're doing some things afterwards there. So it's a very fun way to talk about a disease that a lot of times people don't talk about. And no one really likes to talk about cancer in general. Us guys, we're atrocious at talking about things. And you know, with this study, it shows that when they took the previous studies that showed there may not be as much of a benefit, the European study, when you held it out, 21% decreased risk of death with screening. This study analyzed things in a way that's different, as they took 3 different mathematical models and took all the patients, took all the problems that they had with the other studies. One of the studies, actually, all the people in the screening arms, a significant portion of them had been not screened, and the significant portion in the non-screening arm had actually been screened, complicating the scenario. When they analyzed it, they found that screening translated into 25 to 32% lower risk of cancer.
Wow, that's a big number.
That's a big number. It's important to talk to your doctor about personalizing. And the last thing with this is when to screen. Studies have shown, we talked about this study over the past couple of years, this Malmo study. They followed people, 25,000 people for their life, and they found that that first PSA in your 40s is the most predictive of your risk of prostate cancer. So if it's less than 1, less of a risk. If it's above 1, greater risk. And African American men with a family history of prostate cancer need to get screened starting in their 40s because the risk of something showing up later where it's more aggressive is profound, and early screening and PSA screening does save lives. And
it actually does. I know of someone that it did save their life, so absolutely they should get screened. Women, ladies, drag your man, drag your boo to the doctor and make sure he gets that testing. Very important.
Absolutely.
Before we go,
Yes.
10 seconds. You have any suggestions for this nasty hurricane?
Be smart, be safe. Last week we spoke about all the things with everything going on in Houston. Same models. Early on, you know, we're worried about rain, we're worried about winds. Make sure you're safe. Don't be a hero. Don't do anything that doesn't make sense. Try to be safe. Try to make your family safe. Be mindful if floods arise. Don't go swimming. One of the biggest causes of death around these times and the floods is people go and try to have dares and try to play in the water. It doesn't take much. A foot of water can wipe you down. It doesn't take much. Several feet can wipe a car away. So be very, very, very mindful of that infectious disease. Don't go walking around getting cut. Be mindful of your tetanus shots. Go get your medications before everything happens, because that is really important. A lot of people are without medications. Diabetics need their medications. You want to make sure that oxygen. Be prepared, and do not take these things lightly, because as we've seen before, they can come quickly and they can potentially cause a devastating amount of damage. And be safe. And again, like I said, it's been an amazing few years. I'm glad that I got to be a part of everything here at the chat. So thank you guys. I think I've gained a lot of wonderful friends and family. And I'll tell you, when I go to conferences, people do listen on social media in different places. So I hope our medical education and medical discussions have made an impact. And if it helps one person get healthier, then I think we've done a good job.
Agreed. You've done a great job.
Appreciate you. Thank you for joining us. And of course, this medical contribution was furnished by Kasraeian Urology. You can hear so much more from him on the weekend radio show, The Conversation, Saturdays from 5 to 6 p.m. Stay with us. We'll be right back.